18-year-old Jordan Robinson is in a lot of pain. Shooting flaming arrows at bags of gasoline seemed like a good idea at the time, but it turned out to be a very bad idea, and it landed Jordan in the hospital with severe burns to both of his legs.
I've broken bones, I've done all sorts of stuff, and I've never felt a pain like this. It's just constant, it is intense. It's definitely a regrettable decision. It's some serious pain.
Burn treatment is among the most painful of all procedures. Patients are usually given very high doses of opiates such as morphine to help manage the pain. But morphine has several drawbacks. It doesn't ease all of the pain, and it usually leads to extended hospital stays because patients become dependent on the drugs and need time to be weaned off slowly to avoid withdrawal. Jordan is going to use another tool to manage his pain. His body will still be undergoing painful physical therapy, but his mind will be immersed in a computer-generated world using virtual reality. He is traveling along an icy canyon known as Snow World, in the midst of a snowball fight with penguins and snowmen. Hunter Hoffman is the director of the Virtual Reality Research Center at the University of Washington. He created Snow World.
In this case, we need their bodies to stay there while they're being worked on, but their minds can escape into Snow World, and they have the illusion of going inside this computer-generated world, and that leaves less attention available to process the pain signals.
After his 20-minute physical therapy session, Jordan is smiling.
It does a lot. It helps a lot. I wasn't expecting it to be as helpful as it was. I had never done anything like that before, but I definitely didn't expect it to make as big of a difference as it did.
Dr. David Patterson from Harborview Medical Center in Seattle has been working with Hoffman for years on the virtual reality project. He says VR can be used two ways in burn victims. The first is by distracting the patient. The technology can then be used to help hypnotize the patient, allowing for hypnotic suggestion during burn care.
What we're doing in the laboratory now is trying to combine the two of them and see if they can enhance the effects of each other.
Pain distraction alone has been proven to decrease the pain during burn treatment by between 30 and 50% in clinical settings. Patterson is hoping that by combining both techniques, they can get even better results, ultimately leading to smaller doses of pain drugs. Jordan's mom, Kate Robinson, thinks that anything to decrease his pain is a good thing. While she hopes for a full recovery, she hasn't forgotten the flaming arrows and gasoline that landed her son in the hospital.
As we were driving here, though, I told him that I loved him and I cared about him, and I was really sorry he was going through all this pain. But as soon as they get him patched back together, I'm probably going to kill him.
While Jordan will most likely miss his first semester of university, he is expected to make a full recovery. As for the future of virtual reality technology in medicine, Hoffman says the possibilities are virtually endless. Ben Gruber, Reuters.